Welcome to Never Too Late for Fitness Radio, bringing baby boomers proven strategies and innovative products for getting fit, staying fit, so you can live a longer, healthier, and happier life. Here's your host, best-selling author and fitness advocate, Phil Ferris.
This is Phil Ferris, and welcome to the show. Expert profiles share stories of influencers and innovators overcoming obstacles and achieving success in business and in life. My guest today is Dr. Ryan Comeau, CEO and co-founder of Kinetisense. Dr. Comeau is considered a world leader and pioneer in the field of human 3D motion capture. Dr. Comeau is an innovator, best-selling author, and advocate for the implementation of objectivity and patient engagement in the health sciences. Dr. Comeau is an international speaker and shares his vision for how technology will forever change rehabilitation, movement therapies, and the healthcare system in general. Thank you for being on the show today, Dr. Comeau.
Phil, it's an absolute pleasure. Thanks for having me.
That's great. Well, to begin with, to kind of get right into it, can you tell us about Kinetisense and how it helps people move better?
Absolutely. Kinetisense is a 3D motion capture system that uses a single front-facing camera and is objective, portable, efficient, and allows for the acquisition of movement data of the patient, the client. The system allows for the accurate assessment of human biomechanics, which allows for physiotherapists, chiropractors, trainers, coaches, and researchers to objectively analyze and correct movement patterns. Kinetisense has developed a technology that is being used in functional movement assessment, where this technology is also being used in sports performance, from levels of professional athletes all the way down to amateur, geriatric risk of fall, so being able to assess what the risk of fall in our geriatric population is and being able to apply the appropriate protection mechanisms or rehabilitation to prevent the fall, corporate wellness, research, and education. Kinetisense has created a multi-based or module-based platform that is comprised of Kinetisense movement assessment modules, and as well, we've also brought in third-party developed modules such as Kinetisport, the application of 3D motion capture for analyzing sport-specific movements.
So, Ryan, to help people kind of visualize what this is like, so if a client came into a chiropractor or a practitioner, what would they experience? Could you just describe what that process might look like and how Kinetisense helps that process?
Yeah, absolutely. So Kinetisense uses a single front-facing camera, and it really started off with the Microsoft Xbox camera, which a lot of people understand that technology used in the gaming world. And until now, a lot of practitioners and trainers would have to eyeball their assessments or use these archaic plastic tools. So instead of those old tools, the patient now stands in front of the 3D motion sensing camera, and Kinetisense has created a software system that will pick up the joints of the body immediately. So the patient or the client will see themselves on a screen in real time with all of the joints marked, lit up, and the respective range of motion of those joints as they go through the prescribed exercises. We also represent motion in 3 planes. So it's almost like having a practitioner standing in front of you, standing beside you, and hovering over top of you all at once. So you can see how without a technology such as this, without being able to engage the patient, the client with the visuals, it's very hard to get objective data. We're very limited as practitioners, as trainers, and this obviously affects the overall quality of care.
Okay, and so why are chiropractors, physical therapists, performance coaches, trainers, and even technology groups? Why are they so interested in getting involved with Kinetisense?
Yeah, and really it comes down to the problem that we're trying to solve. There's a major gap that exists between what we see at the clinical grade human motion capture systems, systems such as the Vicon system, and comparing that to the tools and technologies that the practitioners and the movement specialists have in their clinics or their gyms. Systems like the Vicon, which is an 8-camera system that's mounted to the ceiling, where you have the patient or the client wearing a suit with the markers. These systems are great for research, and we see these in these university biomechanic labs, but they have an enormous cost. Some of these biomechanic labs can cost upwards to $3-4 million. The space requirement is tremendous, and oftentimes there's a calibration time required. Kinetisense is an affordable and portable system that analyzes the joint angles and joint planes in real time without having any of the calibration, and with a system that's incredibly affordable. So the practitioners can afford this, the trainers can afford this in the gyms, but even the patient can afford to have a system in their own home. So practitioners and movement specialists no longer have to rely on eyeballing their assessments or using assessment tools that have been proven to lack inter-examiner reliability and overall accuracy. I mean, it's quite crazy. The gold standards that we have for analyzing joint range of motion, the goniometer and the inclinometer, as they're called, these tools were developed and invented in the late 1800s. Yet these are the technologies that we're using, or the tools that we're using. So there is a massive gap that exists, and we're trying to close that gap quickly with technology such as Kinetisense.
Okay, and you talked a little bit about how technology is starting to, and objectivity is entering into healthcare in a lot of different ways. How does Kinetisense bridge that gap?
Kinetisense bridges the gap by producing or creating a technology that can give us the level of accuracy of these systems like the Vicon, and be able to have the reproducibility in assessment, the standardization in assessment, so that every time that patient is analyzed by one or multiple practitioners, it's the same joint, it's reproducible, and the data is valid. And the great thing is until now, the technology to acquire 3D motion, we had to rely on these expensive, huge, cumbersome systems that just did not work and were not feasible for the clinic setting or for the training setting. So we had to then use these tools that these plastic handheld tools in lieu of. But the majority of practitioners don't even use those tools; they simply eyeball. So this becomes incredibly subjective. So Kinetisense, combination of having this technology that was available to the masses, it's affordable. These 3D cameras cost anywhere between $150 to $300. They're incredibly affordable. And then with the Kinetisense system, we're able to allow the trainers, the practitioners, to have a biomechanics lab, so to speak, in their clinic or in their training facility. So that's how we're bridging the gap. We're allowing this high quality research grade type of instrument to be used by all.
And now, with any new technology or anything that comes out new, there's always some apprehension and some misunderstandings. What are some of the misconceptions people may have about using technology in their practice to help them measure and monitor movement?
Yeah, and that's a great question. And when we're talking about healthcare practitioners, we're talking about gold standards, and this applies to the fitness world as well too. We get stuck in certain paradigms. We get stuck in using certain tools certain ways, and that becomes our day-to-day clinical or training process. And so that's the main reason that some may decide not to buy this technology, is that they're not willing to move into this new paradigm change. These practitioners and trainers have been doing assessment a certain way for a certain number of years and are not willing or accepting to introduce a novel way of assessment. We find that, specifically with practitioners, that sometimes adding technology scares them, and they feel that there'll be a large learning curve, which is with Kinetisense definitely not the case. So we are finding that the paradigm of objectivity is starting to take hold, and this is taking hold in the health sciences. This is also taking hold with rehab or fitness, and then it'll soon be required to have this level of biomechanical data, such as what we present with Kinetisense. We're seeing demand from insurance companies. We're seeing demand from these groups that require this type of information. So Kinetisense has been designed to be an affordable solution so that it is accessible to all movement specialists. So that it really comes down to a change of paradigm and a change the way that we do things and the way we're used to doing things.
To illustrate your point, could you share a case study or an example of how Kinetisense helped a practitioner and his or her practice to more effectively run their business as well as help their patients and clients?
Absolutely. And one of the cases that comes to mind immediately is a functional movement assessment. So up to this point, functional movement screens, the ability to analyze or screen someone's movement by taking them through, a series of different movements in different planes and being able to quantify what their dysfunctions are, or what joints or which planes are not moving properly, and how that pertains to their sports. These functional movement screens are becoming very popular, but up until now, they've all been done visually. So it's very, very subjective. So we, and the other thing too with this, is that these functional movement screens, they can take 25 to 30 minutes to do properly.
Okay.
And they really don't engage the patient. So this has been a shift that's occurred in rehab and fitness, that, we're starting to try to find the dysfunctions of movement before they create an injury. We want to look at how this affects performance as well. So we had interestingly enough, we had a football team come in, and we have a system or a module in our system called CAMS, the Kinetisense Advanced Movement Screen. And this is a 3-minute functional movement screen where all of the data of all the joints is captured. And the system will take the player through these different movements and then score them and then give information on where the discrepancies in movement are. And we took the football team through, and like they said, it was a 3-minute assessment for each player, and it was amazing some of the issues that we would find in the issues with the hip, the shoulder, and how some of these old injuries that these players had were still representing themselves in how they move. And even though they weren't in pain anymore or didn't have any discomfort or perceived discomfort or anything like that from their old injuries, it was still affecting their overall performance. And they had found ways in their body to compensate. And these compensation strategies become locked. They become part of the overall matrix of how the person moves, and it obviously affecting performance and also increasing their risk for future injury. So we saw these trends. So now we're starting to see these data trends in these different sports and these different injuries that we see. But one of the really cool cases was one of the football players sustained a concussion, and luckily we did a baseline assessment of his balance, and we were able to know what his normal balance numbers were. Versus just visually looking at his balance, we were able to objectively get that information. So when he had a concussion, we were then able to reassess and compare to what his baseline numbers were, and we were able to go through the process of managing this concussion and getting him safely back on the field once he was back to his baseline numbers. So this is one of the gentlemen that was on the football team where we were doing the functional movement screen, but then we also had the ability to do the balance module because there was a concussion. So my point is the versatility of being able to not only analyze and treat patients that are in pain, which we tend to do as physiotherapists and chiropractors, but imagine how our professions now change when we start to treat people before they get pain. We start to fix their underlying movement dysfunctions before it causes an injury. That's what this technology is all about, and that's how we're going to change a paradigm in the health sciences.
So you're moving from a reactive, illness-based healthcare system to a proactive one, where you're able to identify and correct things or put prescriptive mechanisms in place to prevent injuries from happening in the future based on current conditions.
Exactly. You hit the nail on the head. And that's why we believe that this technology or this type of technology will not only change paradigms in chiropractic, physiotherapy, fitness training, but we think that this is going to have a huge impact on the healthcare system in general. We are talking about a problem that has become an epidemic, where it's a movement epidemic. A lot of the disease that we see, the things that are killing us, are our lifestyle and lack of movement. We're just not moving anymore, and we're not moving well. We're not moving properly. So this even reaches into, our children. Imagine having a system like this in the gym class, right? Where kids can learn how to move. They have the visual feedback in real time, and they can learn how to move better, and they become confident in their movement. And that then goes into, or leads them into loving sport, loving movement, because they have that confidence, and it affects them later on in life, and hopefully helps to reduce some of these horrible diseases that we're seeing. It's about movement, and whether it's performance based, you're a professional athlete, whether you're an amateur athlete that wants the edge, just wants to stay away from injuries, whether you're someone who's had an injury that needs to rehab it properly, or just learning, getting a perspective of how we move and learning better. That's what this technology is all about.
Yeah, because it is. The big thing for the people over 50 population that I usually address is the fact of, let's get moving and moving well. And a lot of times what they'll say is, I don't move more because it's painful, and I lack the confidence to move differently. So I continue to stay in my adaptive responses, which causes me to stay in pain. Until you break that cycle and give them alternatives, but they aren't going to do it unless they can identify what's causing the issue. And then you correct that.
Absolutely.
It allows them to move, and they move more, they feel better, they move more. And all of a sudden health improves, and their state of mind improves. So there's a lot of things that are connected to just being able to move without pain and move well. So that's phenomenal. So tell me, Ryan, what led you to develop Kinetisense in the first place?
It's like any invention that we see. Inventors will think of ideas or inventions will come to fruition, obviously, to try to fill a gap that exists. And luckily enough, my journey with sport and going through learning about rehab, I was exposed to this gap that exists with assessment. And to make a long story short, during my undergraduate time, I was lucky enough and honored enough to be able to work in a biomechanics lab. So we're talking about these Vicon lab systems that this was about a $3 million lab, 8-camera system, and we were doing incredible research on movement disorders there. Research on things like Parkinson's, these different issues that people have, and the data was outstanding. And then that spurred my interest into getting into rehab medicine, and then going to chiropractic school and learning about the different assessment tools that physiotherapists and chiropractors use, I was just absolutely blown away to see that the tools that were employed now were these handheld tools that, like I said, had been around for hundreds of years. And the research is telling us really lack accuracy and inter-examiner reliability. And I stood there in class and I was, this can't be right. This can't be right. This is not only, has a huge effect to the practitioner if they want to be objective, but how does this affect the patient and their process through going through rehabilitation? How does this affect our healthcare system in general, or, a healthcare system that's now going broke? So we have no compass. It was my opinion that we had no compass to gauge how the progress of the patient was going. And this was a massive problem. So that's when we started to look into different ways that we could try to get a high level of biomechanical data, but get it to the masses. And we knew at that time that the new Xbox camera was coming out. And this was obviously a system used for gaming. We were able to apply proprietary algorithms and different coding to be able to accurately assess the joints without the use of wearables. And our goal was to provide this technology at an affordable price so that we could have the chiropractors, the physiotherapists, the medical doctors, the researcher, the fitness trainer, all able to have a system. And then now we're talking about multidisciplinary healthcare, where instead of them all assessing differently with different tools and using different methods, they're now using a standardized assessment. And you can imagine how this now forever changes, the how we do healthcare and better outcomes, better patient satisfaction, right? Because the patient's being analyzed in a standardized way. And the healthcare community, the team that he or she has, is able to share data through the cloud, through a HIPAA compliant cloud, obviously with the sign off of the patient, but being able to share this information and being able to have a gauge, being able to have a compass to move, being able to intervene when intervention's required. And that's what Kinetisense is all about. And that's what our ultimate goal is. And that's the gap that we're trying to fill.
And that's a direction that healthcare is going, is that you have multi-disciplines treating the same patient or the same client in terms of performance or movement patterns, and being able to share data and work collaboratively as opposed in your own little silo is got to make everybody's life a lot easier, and the outcome for the patient or the client has got to increase that much more too. So the question I have now is that if there's with your experience so far, what's the most important question a practitioner or a business owner should ask themselves as they're considering incorporating Kinetisense into their practice?
Yeah, and that's a great question. The main thing with incorporating Kinetisense, the main question is this a technology or adding this technology, is this going to give me the edge? Is this going to differentiate me, my clinic, from the other clinics that are around me? Am I providing a higher level of care to my patients? And that really is the main question. Also, am I able now to transform my clinic from a different paradigm of looking just at rehabilitation of injuries and pain to now prevention? And I would argue that a technology such as Kinetisense revolutionizes the clinic, changes the clinic, changes the way that the patient, the practitioner look at movement. It changes the way that the patient's engaged in the rehab, and the beautiful thing about this technology is it is so easy to use. We've designed it to be so easy to use that it can be used by the practitioner, the front desk staff. So efficiency is always there, and it actually even improves efficiency because it helps to write out a lot of the chart notes for the practitioner or the trainer. They don't even have to go through having to write everything out. It's automatic. Reports are created in an automatic fashion. So it's about differentiating. It's about being very good at what we do, and sometimes technology like this can take us to the next level.
Well, that's very, very powerful. So, Ryan, if people want to learn more about Kinetisense and learn more about you, where should they go?
The best place to learn more about Kinetisense is to go to our website. The website is www.kinetisense.com. We also have a Facebook page, the Kinetisense Facebook page, where we share a lot of information, a lot of research, user profiles. We demonstrate different ways that Kinetisense is being used. And so online through our website or through Facebook is the best way. And our contact information is on there. If anyone wants to contact us and have a discussion, a talk, learn more, we are always willing.
Great. Well, Ryan, thank you so much for sharing your examples and your vision. Very, very excited about the possibilities you're presenting. So thank you very much for being on the show.
It's a pleasure. Thank you, Phil. Thanks for having me.
Have a great day.
You've been listening to Never Too Late for Fitness Radio, hosted by Phil Ferris. To learn more about the guests or resources on our show today, or to listen to past episodes, go to nevertoolateforfitness.com.